you so much. Veronica is my name from Kampala, Uganda. I run a care home called Age Elderly Homes Uganda. And my presentation is leveraging technology in physical medicine and rehabilitation, centering it on care homes or assisted living facilities. Because of time, I'm just going to wrap this up in just like 2 minutes. Technology is transforming the way seniors receive care in rehabilitation and assisted living facilities. And we have a number of technology hubs that we are using at the care home. This help to improve and give us health outcomes and increasing independence on the side of the seniors. So looking at the technology that we use, we are looking at telehealth and virtual care. I've seen different presenters talk about this, different types of technologies, and we also run in the center. So we have virtual care. This one helps us to remotely monitor the clients, because we also do home care where we find the patients in the comfort of their homes. So with the virtual care, we use these machines that help us to monitor the health of the patients. They also help to reduce costs for those that are in remote areas. They also help us to, have easy access to the people that are immobile or mobility impaired patients. We also use wearable devices and sensors. These particular ones help us track vital signs. They monitor falls, and then they also help us to detect anomalies following prompt interventions. On the same line, they also help us enable online education. We run a care school or a nursing school, a geriatric nursing school. So some of the students are in the outskirts of town. So when you put an online training, you help those that can't travel to the city center to get this information. So they access it online. We've also tapped into AI. This one helps us to analyze data from various sources. And of course, with that, you predict health outcomes, the declines, and then you get to personalize the care that you give to these patients. Robotics and automation, we've also tapped into that, though it is still something that we are trying to, because it's a bit costly for us as an organization, but it's something that we are trying to also tap in. And the expertise in my country, people haven't, done a lot of IT, but we try to outsource from different countries. Communication and social media interactions, most of the clients that can afford our services, their families are outside the country. People are probably the UK, the US. So it helps us in communication that someone can video call their mother back in Uganda, or they can do instant messaging. So it helps with the communication as well. The benefits, I'll just run to the benefits. It has helped us to improve health outcomes because we get to monitor their health. We get timely interventions, and the fact that we have personalized their care, it helps us to follow through. The other bit, it has also increased independence, because these elderly people don't have to be confined in one place. They're supposed to have different activities of daily living done by themselves. They don't have to entirely depend on the carers, because also the carers get a chance to rest and cut out on the burnout. So we've tried to use technology to make sure that we improve on the healthcare system in our country. Thank you.